THEMIS trial is a trial of 19,000 patients randomized between Ticagrelor plus low-dose aspirin and aspirin alone. And this is an important question in the population being studied, which is people with diabetes with stable coronary artery disease. This is a group in which it's really uncertain whether antiplatelet therapy is beneficial. What is uncertain is whether aspirin, for example, is effective in people with diabetes. And there have been a number of studies, number of trials where there is clearly uncertainty about the magnitude of the reduction in risk in people with diabetes. So it was an important question and thrown up some interesting findings. The main finding was that there was a reduction of around 10% in the risk of the primary outcome, the MACE outcome. And this is a modest benefit, as the trialists acknowledge, modest benefit. And that was accompanied by an increased risk of major bleeding, TIMI major bleeding, of around a doubling of the risk of major bleeding. Now, one of the things that the trialists then went on to do was to work out whether there were particular groups where the balance between the benefit and the hazard could be enhanced by selecting particular patients. And the second of the presentations today was called THEMIS PCI, where the investigators looked at the PCI group specifically to see if that could be demonstrated. I must say I was not entirely convinced, but they certainly thought that they had identified a group where there was more benefit than risk. I think the jury is out as to whether we really have identified such a group, and we'll have to look at their future work doing modelling to see whether they can find that group.